Good afternoon. Today we're here at the Global Health Conference in Loma Linda, and I'm privileged to interview the president of Adventist Health International, Dr. Dick Hart.
Thank you, Tiffany. Good to be with you.
Good to be here. Please tell me a little bit about Adventist Health International.
Well, AHI has been going for 20 plus years now. Currently works with something over 40 hospitals worldwide. We've emphasized really governance and management, because that's what, everybody says, I need an x-ray machine, or I need a lab, or I need a doctor. But it's really governance and management that creates a system that fills those needs. So rather than just putting on Band-Aids, we try to fix the system. In the Inter-American Division now, which is one of our major divisions, there used to be 14 hospitals. They just added a 15th. So now it's 15 hospitals in that division. So this is Latin America, the northern part of South America, Venezuela, Colombia, Guyana, and so on, and the Caribbean. They have some challenges there. They've got some pretty wealthy places, but they've also got some struggling hospitals. And even some of the wealthier places, a classical one right now is Bella Vista Hospital in Puerto Rico. As so much of Puerto Rico devastated by Hurricane Maria. They're struggling to get back on their feet. The debts are building up. Their power was out. They couldn't take patients. All these things hit hospitals as well. Sure. Probably our poorest hospital in that division is in Haiti. Haiti is probably the closest thing to Africa that you're going to find in the Americas, with all the socioeconomic problems that are there. And of course, Haiti was hit by an earthquake in 2010. And so it's still recovering from that somewhat. What's been fascinating for me, being based here at Loma Linda, is some of our medical school classes say we want to take on a hospital for a project. And the class of 2010, so these are the folk that started in 2006, graduated in 2010, when they were freshmen, said we want to take on a hospital. And they cast about and we talked with them. They said, we want to select Haiti Adventist Hospital. I said, fine, do this. And then they said, well, and we're going to raise $100,000 for Haiti by the time we graduate.
Wow. And
I swallowed hard and said quietly, good luck, but I had no sense that they could do that. They were up to maybe about, I think, $70,000 by about January of their senior year.
Oh, that's incredible.
And then the earthquake hit, and they shot way above $100,000. So that class has stayed involved since that time, raising money and helping in Haiti. But there's still a lot of challenges there, as elsewhere. Dominican Republic, we've got a little hospital that's struggling. Honduras, we've got a hospital that's struggling. They're wanting to expand. Our little hospital in Honduras is now kind of converting to a assisted living center. That seems to be a sweet spot there that's doing. So every country is different. All the challenges are different, but it's an active program in Inter-America.
Sure, and as I understand it, you have one system that's growing rapidly. Is that Curacao?
Curacao, we've just had the chief of party actually for the Ministry of Health here speaking to our conference from Curacao, a government official. There's actually 3 hospitals in Curacao, the whole island. There's about 100, I think it's 160,000 people on the island. One of them is an Adventist hospital, one of them was a private hospital, and the other is a government hospital.
Sure.
Our Adventist hospital just bought out the other private hospital since they were struggling. So now we have
a 3-hospital system.
We have a 3-hospital system, but 2 of them owned by the Adventist Church. And Curacao is an example of a tourist island that frankly has a fairly strong economy compared to a lot of other ones which don't have any hospitals, or any financial base to build from. I just had a conversation yesterday with a mission president from Cuba. They would like a hospital in Cuba. And so maybe that's a project we ought to be looking at in the future, to try to enter some of those areas. So there's a lot of challenges. Guyana is another country that has got a fairly struggling economy. We have a little hospital there, Davis Memorial Hospital, one of the first ones we started with in AHI 20 years ago. But it's on its feet and gradually growing down there as well.
Sure, and all these places have difficulties. One of the other things AHI helps with is the electronics, the infrastructure. So as I understand it, you're also helping to provide an electronic medical record for some of from these hospitals.
And that's a challenge, because before you can get electronic medical records, you got to get computers. Before you can get computers and make them work, you got to get disciplined accounting systems and all that sort of stuff. But yes, we are doing that. We've contracted with a company out of Nairobi, Kenya, a company called SciHost, to implement an integrated electronic medical record, accounting, billing, inventory, a complete electronic record. We've now introduced that in Blantyre, Malawi in Africa, and have just introduced it at Andrews Memorial Hospital in Kingston, Jamaica, and now are just starting right now as we speak, introducing it into Curacao, our little hospital in Curacao. That's a tough road because when you digitize something, you can't digitize your mistakes. You've got to get everything. Computers don't like incorrect information.
Sure.
So it forces you to be very accurate.
And so those are some good work. Do you have any specific story, a highlight that you can share from one of these hospitals that's starting to go down the route of being upgraded?
Well, let me go back to Haiti for a second. One of our alumni from here, a pediatric orthopedic surgeon, Dr. Scott Nelson, was working in Dominican Republic right next door. I don't know if everybody knows the island of Hispaniola is divided into two countries, Dominican Republic on the east and Haiti on the west. Scott was working in Dominican Republic for an orthopedic hospital when the earthquake hit. He flew over, got a private private plane, not a jet, flew over to Haiti literally the day of the earthquake and went in and started doing surgeries. And he worked almost nonstop for 6 months trying to save limbs, trying to amputate where necessary, all the sort of stuff that was there, and made a significant difference. So it's ended up our little hospital. It's kind of become the orthopedic hospital on the island. Now what's happened is that Scott's been back here for a number of years now, but now has just made a commitment to go back as of December and work full-time in Haiti again to try to develop an orthopedic program there that we think will also develop into a rotation for our orthopedic residents here from Loma Linda. So they'll have a chance to go down there and see real orthopedics in that kind of a setting. Even though the earthquake is largely behind us, there's still a lot of trauma in Haiti. There's a lot of other disabilities that they'll be able to work on. And then once you do that, then I've got a physical therapy department that wants to get involved. Then I got a department of orthotics and prosthetics that wants to get involved. So all of the other resources from Loma Linda start to mobilize around a goal like that.
Absolutely. And you know, Adventist Health International has a huge challenge when you get one physician that wants to go out, but now you have to support everything else that comes along with it. He needs support, you know, as far as hospital administration and the wards and the nurses. And as I understand it, AHI plays a big role to try to facilitate improvements on all those fronts.
Yeah. One of the things I've been most pleased with, for years we've had what we call the DMA, Deferred Mission Appointee Program. That has provided debt coverage for medical students and dental students when they go to serve abroad. But a few years ago we got complaints from all the other schools saying, what about us? What about nurses or physical therapists or behavioral health or public health? And so we started another fund we call Global Service Award and have got donations into that. So now any graduate from Loma Linda from any school, if they want to serve abroad, will make their educational debt payments while they are serving. So that suddenly opened up the whole world to our graduates, which is a huge benefit. And you've heard me say this. We can look here and think we're helping the world. The world is helping us because that fundamentally changes the way Loma Linda looks at itself.
Sure.
When we can be engaged in real issues around the world, that keeps Loma Linda true to its mission.
Absolutely. So, you know, the mission of making man whole. Sure, you can do one surgery on one limb, but then there is the rest of the care, emotional, spiritual, and post-surgery care that comes into that. Right. Certainly to help that sort of thing forward. So Adventist Health International, serving so many hospitals, how can you possibly help that many hospitals out there?
Well, we get stretched thin, and we can't respond to all the requests we get, as you know. But we try to do what we can. We've got 40-some hospitals now. We get around $2 million in donations a year, and then we spread that out very carefully to the places that need to have it. We have a full-time laboratory technologist who just travels around fixing lab equipment at these hospitals. We have a biomedical technician that works on equipment before we send it out, so we make sure we got good equipment going out. So it's a very complicated process to keep all the pieces of a modern hospital functioning.
Absolutely. So if you could give one appeal to the listeners, what would you want to ask?
I would suggest keep believing in missions. I mean, there's a lot to do out there, and this is still an obligation, I believe, of the world church, that we cannot disconnect from the needs that are out there. We need them and they need us. And so having that whole thing stay tied together, it helps me certainly in preparing young professionals to serve the world when they can have a chance to engage with real human need in real circumstances.
Yeah, we ask that everyone continue to have that mission spirit. If you can join us in any way, we ask for your prayers, for financial support, and for volunteers to help Adventist Health International to maintain our mission hospitals overseas.